Placenta accreta remains a rare complication of pregnancy. However, it is becoming more common, and much of the early research really focused on the medical complications of accreta, such as bleeding, and ways that we can address that and improve outcomes for mums. But in the last few years, we've started exploring a huge amount about the lived experience of this condition, the emotional consequences, and the mental health impact that this can have on both mums but also their partners. And we've been really fortunate to collaborate on a number of research studies with Placenta Accreta Ireland. And we found some really interesting results. So one of the first studies that we did, we collaborated with an American group, and this was a survey study about quality of life, where we found that this condition had a really prolonged impact on women's mental health. And even as women's physical health started to recover, that mentally, for many years, some women really struggled in the aftermath of this condition. And in order to delve into that a little bit deeper, we've conducted a number of interview studies with parents, so both mothers and fathers were invited to take part in this research. We found that during the pregnancy, many women go into a survival mode and maybe don't appreciate some of the complications that they might have later on, because they're really just focused on getting through this pregnancy, getting to their baby. And then a lot of the challenges actually happened in the aftermath of this condition. So a lot of women really struggled with change in their physical bodies. For some that had hysterectomies or had, big physical scars on their abdomen. We found that a lot of women had, post-traumatic stress in the aftermath of this diagnosis and really struggled in the aftermath. And similar for their partners, we found that it wasn't just the woman that was affected by this, but actually their partners and their families as well. And that overall, this really is a very challenging and frightening condition. And we were able to see in that research things that we can do to support mums and their families on this journey. And we've built that into a family-centred care package, kind of recommendations of care, a lot of which are really simple things, such as having the same person looking after them throughout the pregnancy, providing people with information and resources, and continuing that follow-up in the postnatal period. We have just published the first national guideline for the management of placenta accreta spectrum in Ireland, and we were really delighted to be able to work alongside advocates from Placenta Accreta Ireland as part of this committee, so that the recommendations that we have produced, we were able to integrate all of the findings from the research that we have done in terms of the additional supports that mums need during the pregnancy, but also afterwards and into the postnatal period, such as counselling, physiotherapy, social work, so that there's a more broad, holistic view to the care, so that women are looked after in specialist teams, that they get the medical care they need, but equally that those other things are addressed during their care as well.